Hi everyone, I'm Dr. Robin Berzin, the founder and CEO of Parsley Health, and we obviously have a big news story happening this week around COVID-19. This has gone from something that was happening primarily in other countries to being something that is in our backyard. Schools are closing, the stock market is affected, and a lot of people have questions, especially our members have questions about how we're approaching this. So I want to give you a little bit of background information on how we're approaching this at Parsley Health. And then I want to give you a couple of ways that you can boost your immune system so that you are in the best state to fight off any virus that you might encounter at this time of year. So first of all, I think we need to all take a collective big inhale and exhale. And the first thing not to do is panic, right? That is not going to help you. That is not going to help anyone. We know so far about this virus that the average age of death is around 80 and that people with pre-existing conditions, underlying health conditions, are the most infected. That's things like heart disease, diabetes, autoimmune disease, cancer, HIV/AIDS, anything where you have a compromised immune system or compromised cardiovascular system or underlying lung disease. So these are the areas where you should be really careful. If you're a member, make sure you're talking to your Parsley doctor about your risk. If you're not a member, make sure that you are talking to your doctor about your risk and understanding your risk. That's number one. The second thing that we all need to do is follow the guidance of our public health organization. So washing hands and washing them thoroughly for at least 20 seconds, avoiding sick contacts, and staying home if you're sick. That is the number one thing that you can do to keep this virus from spreading, is staying home if you're not feeling well. So please keep that in mind and take that adage seriously. This is something to be taken more seriously than ever before. And what we're going to see is a massive increase in the number of positive tests. And I want you all to have that context. We're going to test a lot more people, so we're going to have a lot more positive results. If you all remember math from growing up, we have the numerator and the denominator. So what we're going to see is that the overall number of people diagnosed is going to go up, and the number of people who, the fatality rate, the number of people who die from it, that percentage is actually going to go down. Doesn't mean we take this any less seriously, but I want everyone to be prepared for that context, right? Now, we will be screening you. Just because you're not feeling well today doesn't mean you need to be tested for COVID-19. There are a set of screening questions that we will ask you to make sure that you actually need a test for COVID-19. We don't want to overrun our healthcare system. We don't want to overrun our laboratory system. We want to be really judicious in making sure that the right people are getting tested for this virus, not just everyone getting tested for this virus. Okay, so that's the context that you should be aware of, and we'll have more for you as this continues on. Now, I want to cover a couple things today that can help you boost your immune system, and this is relevant to anyone, whether you have an underlying condition, whether you're young or old, whether you're healthy as a horse, whether you're not sure, whoever you are, beyond all of the precautions that you should be taking to be sure that you don't acquire or transmit COVID-19, we want to make sure that your immune system is in tip-top shape. And so number one, that starts with what you're eating. The number one thing is make sure that you're on that anti-inflammatory diet that we teach you at Parsley Health. So eliminating refined flours, refined carbohydrates, refined sugars from your diet is number one. Stocking up on immune boosting fruits and veggies. So those are all of the brightly colored veggies. This is definitely your time to eat a ton of vegetables and to eat a rainbow. Make sure that you're getting plenty of protein, healthy fats, omega-3 fatty acids through things like walnuts, through cold water fish like salmon. Make sure you're getting your healthy fats, as omega-3 fatty acids are immune boosting, and then getting all of those polyphenols and anthocyanins and other great immune boosting phytochemicals from your fruits and veggies. That's the number one thing you can do. And again, getting out all of that processed food, that sugar. When you're eating a high sugar diet, you are inflamed and your immune system is not as effective. Okay, so that is number one. Look at what you're eating. The next is exercise. I know we all talk about exercising, and exercise is so important. Yes. But it's even more important because exercise has actually been shown to improve immunity and to improve the efficiency and efficacy at which your immune cells fight off bacteria and viruses. If you have been hiding at home and maybe a couch potato through all of this, now is the time to break out those resistance bands and your medicine balls, those videos, those at-home workouts, and to make sure that you are still moving, because moving and building muscle mass is one of the best ways that you can make sure that your immune system is in top fighting shape. Next one is sleep, right? We know that our immune systems don't function as well when we don't sleep, and 1 in 3 Americans are not getting enough sleep, as I make sure I have my stats. So folks who are sleeping less than 7 hours a night, your immune system is not poised to fight off anything. Again, this could be a cold, this could be a flu, this could be a bacterial infection. So whatever it is, just make sure that you are feeling, you are getting a good night's sleep and that you're taking priority of your sleep. Next up, supplements. So everyone is asking us, what supplements should I be taking to boost my immune system? We already have an article out there on this, and you should definitely go check out our blog because we've listed this already for you. I personally am taking 5,000 units daily of vitamin D3K2. That is a good amount. If you have been tested and your doctor or provider has recommended a different amount, then follow that advice. We're also recommending taking enough omega-3 fatty acids. While omega-3 fatty acids haven't been found to be effective in heart disease specifically, they are incredibly important for our bodies. They're incredibly important for our immune systems. They're important for the integrity of our cells. So we ask that you make sure you're taking your omega-3s. And those are some of the supplements that we're recommending. We also have a supplement called Bodyguard or Virusid here at Parsley, which I recommend if you're feeling under the weather to help you fight off something. So talk to your Parsley provider about that. And then the last one is managing stress. So I know we all feel this existential stress right now, and you want to make sure that you're taking that seriously. When you're stressed out, your immune system does not work as well. And there's tons of research to show that your body's not able to heal or fight off infection when it's under chronic stress. So now is the time to actually do that meditation guide and do that meditation practice. Even something as simple as 5 minutes of a breathing practice every single day is an important thing that you can do to lower your stress levels, importantly lowering your cortisol and stimulating your parasympathetic nervous system, because when your parasympathetic is live, that means you can rest, digest, relax, and heal. Okay, so we've talked about food, we've talked about exercise, we've talked about sleep, we've talked about supplements, and we've talked about stress. Addressing those 5 things is really our baseline recommendation for everyone to support your immune system at this time, in addition to following precautions that could protect you from COVID-19. So please stay aware, please stay tuned in. We're going to be sharing more about this as the week goes on. Thanks.